Hey, Dave O'Sullivan here. Now in today's training we're going to talk about how to know if you're on the right track. So again, this is another question that's been emailed to me a lot, is what to do when you're not quite sure if you're on the right track. Well, my question to you is, what's happening in that first session? Now you've probably heard me talk about this before in other training videos, but what are you actually doing in that first session? So in that first session we should have a clear understanding of where the person wants to get back to. Once we have that understanding, then the rehab is just basically a reverse step-by-step process, okay? So then you will always have your reference in relation to where you want to get to, okay? So if I know someone wants to get back running and they've come in with, your bog standard knee pain, I know realistically it may take 4 sessions, it may take 5, it may take 6, depending on the level of adaptations that the nervous system has put down, okay? How irritable the patient is, how acute it is, how many previous injuries they had, etc. But give or take, I know what I need to be doing in session 1, I need to know what I've been doing on session 2, I need to know where I need to be session 3 and 4 in order to have the person on track to be back running by a set period. Now granted, I've had to do this for the last 10 years working in professional sport. I've had coaches saying, when's he back training, when's he back playing, etc. Okay, but you always work backwards, okay? And if that person, okay, is on track to progress to the next level on the next session, progress to the next level on the next session in order to hit that target, then things get very, very easy. What I see a lot of therapists doing is the patient comes in and they start treating session by session, okay? They come in, they assess, their head is fixated on the part of the body that's the problem, and they just treat that. They come back in, they assess that, they come back in until that patient asks that dreaded question, when will I be able to run again? Okay, now compare that versus what happens in this clinic. Okay, when that person comes in that initial assessment, we've got a clear understanding of where they want to get back to. We've got a clear understanding of their story, we've got a clear understanding of what we need to undo, and then we've got a clear understanding of maybe new movement habits that we need to introduce. Okay, but how we do that is the next progression is the next logical step, okay? So just because someone's pain-free in the treatment room doesn't mean that I know for a fact that they're ready to run, okay? So we have to take them through that graded exposure, because if we know one thing about the nervous system is we know the nervous system doesn't like massive changes, okay? Massive changes in load, okay? We can see that from the work of Tim Gabbett and the likes, okay? Massive changes in stress to the system, okay? The first thing that we naturally tend to do is we tend to react, flare up, whatever, okay? So what we need to do is we just need to get that nice graded exposure in place so that we can get that person back to where they want to be, okay? Now, if your patient is in session 2 and session 3 and you're doing the exact same stuff that you were doing in session 1 and you're spending loads and loads of hands-on time, okay, doing hands-on treatment, etc. in session 3 and session 4, then I would question whether you are genuinely on track. Because what should happen ideally, okay, from my experience, is you should be doing less and less hands-on treatment as the sessions progress, okay? Because you can use your hands-on treatment as the starting point of loading these tissues that the nervous system is perceiving a threat to at the moment. Okay, but if we're using our hands on, we're putting the patient on the bed for half hour, 30 minutes, then we get them up, we're giving them 1 or 2 exercises, then they come back in, they felt all right leaving, and the pain comes back, then I would question, are you truly on the right track? Okay, so get your plan in place. First session, you should be able to map out where that person needs to be by the 5th, by the 6th session. Okay, by the 5th session, they need to be doing some high level hopping for me before they're allowed to run. Okay, so you don't have to tell the patient the plan out loud, but in your head you have to have that mapped out in that first session. And in my clinic here, I expect to know exactly the plan in place, because if that person does not have a plan in place, okay, then I know my therapists are guessing. Okay, I know my therapists are working session to session. And working session to session is the quickest way to get overwhelmed, to get your patients not buying into your treatment plan, to get your patients not adhering to their exercises, and it's probably the quickest way for you to start questioning yourself, seeing, am I on the right track? Because before you know it, you do the same treatment program, the changes that you got from that novice stimulus of hands-on treatment in the first session aren't as great now in the third, fourth session, and all of a sudden you're just doing the same treatments. The patient's getting pissed off. They've paid 200 quid plus, okay, by this point, and now the pressure is getting on you, okay? Whereas if you've taken a step back, you get your structure in place from that assessment, you nail the initial assessment, you get your treatment plan in place, it takes all the stress, okay, all the overwhelm, all the doubt, all the frustration away, okay? And you can focus on implementing that plan, okay? So the next time you're questioning yourself, am I on the right track? Just step back and reflect what happened in the previous sessions, and specifically the first session, okay? We'll go into this in a lot more detail in up and coming training videos. As always, thanks for listening.